So as everyone's getting situated back into your seats, my name is James Pittman. I am from the VA Center of Excellence for Stress and Mental Health. I am also an assistant professor in the Department of Psychiatry. I want to welcome you all back. So our next phase of presentations is called Ignite. So these are Ignite presentations, and with a show of hands, has anybody seen or heard of an Ignite presentation? Okay, a good bit of you. So for those of you who don't know what Ignite is, it is a very brief presentation. It's 5 minutes. Each presenter gets 20 slides, and it it goes to the next slide every 15 seconds. So this should be very exciting. They're meant to be pithy, fast, brief, and we thought we'd do this fun little experiment for this conference. So our first presenter I will introduce is Tai Seale, who will be our first at this very cool event.
Check one. Okay, great. Excellent. Thank you very much. Good morning. I'm going to present to you a study that involves 3 health systems: UC San Diego Health, Sutter Health, and Reliant, of a study called Open and Ask, in short. And then this is the more official title in PCORI's in their website. And I certainly acknowledge PCORI's funding. We're very, very grateful. And the detailed information of the contract is there. It's a 4-year project. We're 1 year into it. Many of you probably have seen this episode of Seinfeld. How many of you? I'm using precious time. Excellent. Thank you. So Elaine was a difficult patient, right? She didn't want to do what the MA who roomed her to do, is to put that little gown on. And she was labeled a difficult patient, and she suffered a very unpleasant consequence. Laughter aside, many of us can relate to awkwardness when we saw our physicians. Doctors can also relate to difficulties with talking to patients who prefer doing something else. So our study wanted to address a gap in dissemination and implementation. We know over decades of research on patient-physician communication and relationship, there's a lot of evidence on the benefits of patient engagement, patient activation, on knowing patient's agenda, on negotiating a joint agenda, on physicians showing empathy, doing shared decision-making. However, the reality in real-world practice, patients sometimes are lost in the words. They don't know what to say. Before they know it, time is up. So we're trying to bridge the gap with this study that we call Open and Ask. And we're doing a comparative effectiveness trial of 2 interventions. The aim is to improve patient-centered communication. So it's a multi-dimensional, multi-component intervention. We start with a video, animated video for patients and physicians. And then for patients, before their visit, we want them to go to My Chart on My Health Online to enter into it a questionnaire that they'll answer, that will talk about what's the most important thing I want to talk to my doctor about. And then during rooming, we want the MA and the nurse to assure the patients, yes, your doctor does want to know what's most important to you. And we want to make sure it's documented in the EHR. And then for the physician side, we will have standardized patient instructors who will function as coaches on patient-centered communication. So this is what we call the high-touch arm, because we actually send a real person, a standardized patient instructor, to coach physician about patient-centered communication. And then we have another arm we call high-tech, that we're building a mobile app that will do this coaching using a mobile app. Another arm of it is low-touch and low-tech that we call Ask. Basically, we remind patients and physicians to discuss 3 questions that are critical to shared decision-making. And that will be in the form of a poster we will put in the exam room. These interventions have been tested in an efficacy trial that's also funded by PCORI in a pilot study, and the results were published in Health Affairs in 2016. So the specific aims of this study, one is to engage with patients and provider stakeholders to refine the interventions we developed in the pilot study into real-world clinics in 3 systems. The second is to conduct the large-scale cluster randomized controlled trial. And then the third is to identify the strategy that has the most potential for sustained impact and replication within and across healthcare systems. So the third one is more relevant to the D&I work that we're talking about in this summit. This is the research design is we're using mixed methods. What you're seeing now is the more quantitative side of the randomized controlled trial. And then we also have the more qualitative piece on qualitative inquiry about the implementation side. We'll do activity-based costing to understand resource use, acceptability, sustainability, and scalability of our intervention. We have a great multidisciplinary team representing multiple perspectives. And this is just a slide on the wonderful collaborators that we have at UCSD. So each of the other sites will have also an equally wonderful team. In terms of patient and provider stakeholder engagement, we engaged with them from the very beginning in the proposal development, study design, vetting our software developers, developing our tools and refining it. And we plan to continue to engage with them till the end of the study. So the D&I relevant measures include fidelity to the intervention protocol and the extent to which the program can become institutionalized. Some early lessons learned that may be relevant to D&I is identifying pain points that would resonate with key stakeholders. It's important to engage with key stakeholders, and although it does take a lot of time and effort, that kind of spells to resource. Pay close attention to organizational culture, and I heard people say culture eats strategy for lunch, and I can relate to that many times. And support from physician leaders is essential, and also we need to have the startup spirit, and definitely humility and the learning attitude in doing this study. So here, I want to thank you for inviting me, and I think my time is up.
All right, thank you. So we have time for just one question. One lucky participant can ask one question.
Sure. So you mentioned, wow, that's impressive. You mentioned the amount of time and effort that goes into really getting that genuine engagement throughout. Could you speak a little to what those challenges are and how you've overcome them? I know you've done this before.
Oh, thank you, Alan, for that question. Yes, so we're working with 3 health systems, Sutter Health, UCSD Health, and the Reliant Medical Group that's in Worcester, Massachusetts. So we work with both the clinical leaders and also the health IT staff and leaders. Just as an example, because we want patients to put basically their agenda or their priorities into the patient portal, patients' response had to go into the Epic part, the part of Epic that clinicians will be able to see. Now, MAs don't see what doctors see, and doctors don't see what MAs see, and the questionnaire answer, where do you put, into the physician's view and the MA's view, those are all decisions that need to be made. So we work very closely with them, and there's definitely adaptation that's happening, and we're documenting them, and it takes a lot of time.